Hi, I'm Laura, a public health nurse at the Thunder Bay District Health Unit. I'm here to provide information for people who have been identified as a high-risk contact of a case of COVID-19. If you are watching this video because your child is a high-risk contact, then know that when I say you in this video, that I'm referring to the high-risk contact or your child, and not you as a parent or a caregiver. I recommend that parents of school-age children who are part of a dismissed cohort of close contacts watch the other video linked on this page that was made just for you. There are 7 main things to know right now. First, being identified as a high-risk contact does not mean you have COVID-19. However, COVID-19 is a difficult virus because a person could be infected and just not know it yet. So, they can have the illness and spread it to others before any symptoms develop, which can actually take up to 14 days after someone was exposed. Number 2, to try to reduce the potential spread of illness to others, you are now required to self-isolate for 14 days from your last exposure to the positive case. If you live in the same household and you are not able to fully isolate from each other, you must self-isolate for 14 days from the last exposure to the last positive case in your household. Self-isolating essentially means to stay home and avoid contact with other people as much as possible. If you live alone, please ask a friend or family member to pick up supplies for you or shop online and arrange for the things you need to be delivered. Have drop-offs left at your door so there is no risk of contact with a delivery person. When you are self-isolating, do not invite visitors over unless they are considered essential, like home care providers. But make sure to tell them that you are a close contact of COVID-19. It's also really important to stay away from seniors and people with chronic medical conditions like diabetes, lung problems, or immune deficiency. You can go outside as long as you have no symptoms of COVID-19, but you must stay within 2 meters of your property boundary or stay on a balcony if you live in an apartment. Number 3, COVID-19 spreads really easily, so it's important to follow infection control measures to keep everyone in your home safe. This includes staying in a separate room away from other people in your home as much as possible, and using a separate bathroom if you have one. If you are in a room with other people, make sure that there is good airflow. Keep a distance of at least 2 meters from others at all times. And everyone should wear a mask that covers the nose, mouth, and chin without any gaps. Also remember to wash your hands well and often with soap and water, and dry them with paper towel or with your own cloth towel that nobody else shares. If soap and water are not handy, you can use an alcohol-based hand sanitizer. If you have to cough or sneeze, do that into a tissue or into your elbow, but not into your hands. Throw your used tissues into a lined wastebasket and wash your hands right away. After you empty that wastebasket, don't forget to wash your hands again too. Another way to reduce the spread of germs is to make sure that high-touch surfaces like doorknobs, light switches, remote controls, faucets, those type of things, are disinfected at least twice a day. Number 4, you may be wondering at this point about how your self-isolation impacts the people you live with. If you, as a high-risk contact, have or develop any symptoms of COVID-19, even if they are mild, all those living in the same home must also self-isolate right away. I'll go over what those symptoms are in a moment. As always, we encourage everyone to be closely monitoring their health for any signs of illness. At this time, any children in your household must not attend childcare or school or any extracurricular activities in person during your risk period. Parents and caregivers should work with the school to arrange other learning options. Note that this is not in the Ontario School Screening Tool and must be considered separately. Other people in the home are asked to stay home too, but as long as you do not have any symptoms of COVID-19, they can leave the home but only for essential reasons, such as going to work, getting groceries, or picking up medicines. To some people who have COVID-19, it feels like a cold or a flu, but for others, it's much more severe. As a high-risk contact of COVID-19, it's really important for you and the people you live with to monitor for any symptoms that would be new or worsening and not related to a known health condition. Symptoms of COVID-19 include a fever, a temperature of 37.8 Celsius or 100 degrees Fahrenheit or higher, chills, cough, shortness of breath, sore throat, difficulty swallowing, runny nose, stuffy or congested nose, decrease or loss of taste or smell, pink eye or conjunctivitis, headache that's unusual or long-lasting, digestive issues like nausea, vomiting, diarrhea, stomach pain, muscle aches that are unusual or long-lasting, extreme tiredness that is unusual, falling down often, this may be seen in older people, sluggishness or lack of appetite for young children and infants. You know your body best. If you had any of these symptoms recently, if you have them now, or if you develop any, even if they seem very mild, please call public health right away at 807-625-8341. Getting tested will help you to know if it is COVID-19 that may be causing your symptoms or not. Test results are also very important for public health to understand how much the virus is spreading. If you have been identified as a high-risk contact because you live with someone who has tested positive for COVID-19, you are advised to get tested right away. You should also get tested again in 10 days. If you are a high-risk contact because you've had an exposure to COVID-19 outside of your home, then public health will be contacting you to provide information about when to get tested. Please do not use public transportation to access your testing. It is better to use a private vehicle if possible. If you must share a vehicle with someone else, please sit in the back and wear a medical grade mask. Travel with a rear window open, weather permitting, of course. If the test result is negative, the full self-isolation period must still be completed. That's still the full 14 days. If it is positive, we will call back right away and will continue to provide support. You'll be given further instructions on self-isolation and advised when it is safe to return to your regular activities. If at any time symptoms are worsening, call telehealth or a healthcare provider. If urgent medical help is needed, please call 911 and make sure to tell the operator and the care providers that you are a high-risk contact of COVID-19. Also wear a mask if possible. The last point I want to make is that it's not just your physical health that we care about, but your mental health matters too. If you're looking for support, please visit tbdhu.com/mental health resources. Remember that reaching out for help is a sign of strength, not a sign of weakness. Well, that just about covers it. If you have any questions, I encourage you to browse our website. There's a lot of information there. You can also contact our call center at 807-625-5900 or toll free at 1-888-294-6630. Feel free to also send us a direct message via our social media channels or through the Contact Us feature on our website. Our phone lines are very busy, so please be patient. We're all working very hard to respond to inquiries as quickly as we can. I hope this information has been helpful. Please take good care of yourself.